Well, we're following the COVID-19 situation in long-term care homes in Ontario. Hundreds of long-term care homes in the province are struggling with COVID outbreaks right now, confining residents to their rooms. This as more staff head into isolation. Now, over half of Ontario's long-term care homes have outbreaks right now. The number of workers in isolation also surging. More than 3,800 people are off sick. There are now calls for more support for these facilities province-wide. Now, to talk about this, we're reaching out to Vivian Stamatopoulos. She is a long-term care advocate and researcher who joins us now from Toronto. Vivian, always appreciate your time and insight. Thank you for being with us today.
Thanks for having me, Michael.
Listen, I'm hoping to begin here with a bit of a snapshot. Give us a sense of what it looks like right now in long-term care at this point of the pandemic.
I mean, it's incredibly dire. This is probably, one of the worst situations we've been in, matched only by the height of, the second wave, where we were losing seniors by the hour. I mean, I think the most upsetting part is that a lot of this was predicted, and we could have certainly blunted the curve so we wouldn't be at this level of frankly, disaster that we're in right now. I mean, there's just not enough staff available. There's almost, as you said, nearly 4,000 workers sick right now. Who is replacing that care? We know we can't rely on rapid response teams that we used to rely on in previous waves because the hospitals are also dealing with their own staff shortages. So who's actually in providing the care? I fear that we are back at the days of, the height of the military report era, where we were hearing about residents who weren't being fed properly, weren't being, undetected illnesses, undetected falls, neglect leading to preventable death and injury. And the fact that we're here again is inexcusable when we've had 2 years to prepare. You just kind of throw your hands up and say, how are we here again?
I'm going to talk about the political response in a second, but I do wonder about the stories that you might be hearing right now. What exactly is being said by long-term care workers about residents in these homes? You talk about situations which go undetected and really, when you look at the first wave, unreported for quite some time because we didn't really know what was happening behind closed doors. So what are you hearing right now from residents and workers?
I mean, the workers are completely burnt out. They're scared. They're not being provided proper PPE to keep themselves safe and the residents. And we all know this. They have yet to mandate N95s to be used at all times in these facilities, which is mind-blowing, given that we have advice from Public Health Ontario that says that everybody should be wearing N95s, even if not fit tested. Yet we haven't mandated it in long-term care yet. We don't have daily rapid testing of staff. The mandate is only for 2 times a week. We didn't prioritize boosters for staff, which is why we're in this situation of mass, staffing shortages. And this is something that I was warning this government of in early December when we were hearing about Omicron, and we could have acted. They could have acted more appropriately, but they didn't. And we lost our window to act in time. And unfortunately, now we're here watching the tsunami hit. Residents are saying that they've been, confined for upwards of a month. In these situations, when there's even sometimes just one staff case, the residents are trapped in their rooms. They can't even walk down the halls. No baths, no showers. Can you imagine what life is like? They are telling their families, they are telling us that they would rather die than live in this solitary confinement. They've already been traumatized before, and they're being continuously re-victimized by terrible policy and the lack of proactive action to, make their lives somewhat enjoyable in their final days. It's very disappointing.
You say we lost our window. When would that window have been, Vivian? When could the government have acted, and what should have they done ahead of this?
I mean, there's no question. In early December, I remember the day when I started warning Minister Phillips about, the outbreaks starting to increase. That was December 7th. There were only 7 homes in outbreak right now. There's over 330 now. I mean, this is inexcusable. And I said, mandate N95s, prioritize boosters among the staff, because thankfully we have the vaccine mandate, which means that we have prevented workers from having the more serious outcomes, but it doesn't prevent them from contracting COVID. And we knew this was going to happen. So we said you have to get mobile clinics to these homes right now and, staff up in terms of having a plan, getting them their boosters, and obviously doing daily rapid testing, because twice a week, of course, you're going to have cases slip through the cracks. And that's exactly what has happened right now. I mean, much of this is preventable. And the fact that we are here again, and we heard very little over the December month from the minister, which was probably the most upsetting part. I mean, their enhanced measures came December 28th, and they're laughable. They're not enhanced measures.
Without a doubt, there are people with loved ones in long-term care right now that are hearing this discussion, that know of the situation, who are debating whether or not they pull their loved ones out of those homes in order to give them a better quality of life and to ensure their safety. But But acknowledging that not everyone can do that. Not everybody has the resources to do that. What needs to happen now? What is your message in terms of an action plan for the provincial government?
I mean, immediately do the things that I've been asking you to do. Those, key actionable items are there. I mean, a lot of it is too late, but at least N95s will help prevent the spread and getting the boosters. Do those things. But furthermore, we are at the point right now of no return. This level of staffing crisis is unprecedented. So I don't see how we get through this without, getting federal assistance in the way of the military or the Red Cross. But unfortunately, I don't have much hope that they will do that. Given that they turned down that same federal help at the height of the second wave when we were indeed losing seniors by the hour. So, if they actually cared about getting in help and acted like this was the emergency that it was, they would call on every single possible, source of labor that we can get into these facilities, in addition to increasing the access of family members, many of which are triple vaccinated, and will do whatever it takes to assist and get in there and help to prevent the dangers of isolation. Because make no mistake, isolation kills. I mean, there is significant evidence against the dangers of this. We need to help these residents. We need to help the workers. And right now, I see no plan to do that. None.
Vivian Stamatopoulos, difficult subject to discuss, but important information to get out there. Thank you for your time.
Thank you.